The incidence of kidney disease is escalating, with more than 37 million American adults currently grappling with chronic kidney disease. What's even more concerning is that many are unaware of their condition until it's too late. Kidney disease often lurks without symptoms in its early stages, allowing damage to escalate unnoticed for years before diagnosis. But what if I told you there are natural remedies that can halt kidney disease progression and even reverse existing damage? Vitamin D and green propolis offer potent protective effects on the kidneys and can substantially diminish protein in the urine, a hallmark of kidney disease. Stay tuned as I unveil the undisclosed remedy for kidney disease that your doctor might not inform you about. First, let's delve into what chronic kidney disease entails. Your kidneys serve as blood filters, eliminating waste and excess fluid while maintaining electrolyte balance. Kidney disease indicates kidney damage that impairs proper blood filtration, allowing proteins like albumin to seep from your blood into your urine. This protein presence in the urine, known as proteinuria, is a critical diagnostic marker for kidney disease. The more protein present, the greater the kidney damage. Left unchecked, chronic kidney disease steadily advances until kidney failure ensues, leaving kidney transplant or dialysis as the only recourse, a painful treatment involving blood filtration thrice weekly. Thus, it's imperative to explore avenues to forestall further kidney damage and lessen proteinuria. This is where vitamin D and green propolis enter the picture. Let's begin with vitamin D. While renowned for its role in bone health due to its calcium absorption facilitation, recent research underscores its formidable protective effects on kidneys. Studies indicate a close correlation between low vitamin D levels and kidney disease progression and severity. The lower your vitamin D levels, the swifter the decline in kidney function. Now let's examine how vitamin D mitigates proteinuria and safeguards kidney health. Firstly, it quells inflammation, a major driver of kidney damage, by suppressing the immune system's assault on the kidneys, which incites tissue damage and scarring. Secondly, it activates the renin-angiotensin system, RAS, pivotal in blood pressure and fluid balance regulation, thus rectifying RAS dysfunction common in kidney disease. Thirdly, it curtails fibrosis, averting scar tissue buildup in the kidneys and its attendant functional decline. Fourthly, it enhances kidney tissue oxygenation, mitigating cell damage and death due to oxygen deprivation. Lastly, it directly shields kidney cells, reducing cell death and promoting normal cellular function. Consequently, vitamin D not only forestalls further kidney damage, but also boosts kidney capacity, leading to reduced proteinuria and enhanced kidney function. Numerous studies affirm that rectifying vitamin D deficiency diminishes protein in the urine and decelerates kidney disease progression. In one study, vitamin D supplementation slashed proteinuria by an impressive 38% over 3 months. Patients with adequate vitamin D levels exhibited markedly lower proteinuria incidence than those deficient in vitamin D. Another study reported that vitamin D not only reduced proteinuria, but also alleviated fibrosis, resulting in improved kidney function. The crux lies in maintaining optimal blood vitamin D levels. Health authorities define sufficient vitamin D levels as 30, 60 ng/ml, yet up to 75% of kidney disease patients fall below 30 ng/ml. The silver lining is that optimizing vitamin D levels is uncomplicated. Undergo testing to ascertain your levels, then supplement as necessary with vitamin D3 capsules or sublingual drops to attain ideal levels. Additionally, prioritize sensible sun exposure to enable natural vitamin D synthesis in your skin. Vitamin D stands as a safe and affordable supplement that should be a standard treatment for anyone. Now, let's delve into our second kidney powerhouse, green propolis. Crafted by honeybees from plant resins, propolis boasts a millennia-old medicinal history among humans. However, not all propolis varieties offer equal kidney benefits. Green propolis, sourced from Baccharis plants in Brazil, harbors unique healing compounds validated to shield your kidneys in various ways. Primarily, green propolis serves as a potent anti-inflammatory agent, akin to vitamin D, by quelling inflammatory cytokines, enzymes, and free radicals. This action curtails an overactive immune response that inflicts harm upon the kidneys. Furthermore, green propolis inhibits fibrosis by thwarting TGF, B1, the chief fibrosis activator in kidney disease, thereby safeguarding kidney function. It also diminishes oxidative stress, a particular threat to kidneys, by neutralizing free radicals before they harm kidney cells and tissues. Additionally, it deters apoptosis, reducing cell death and fostering sustained kidney function. Finally, it actively prompts kidney cell regeneration and healing, facilitating recovery from existing damage. Studies, both animal and human, substantiate green propolis's real-world efficacy in translating these protective effects into tangible improvements. In rats afflicted with chronic kidney disease, green propolis reduced proteinuria by 29%, alongside mitigating oxidative damage and fibrosis while preserving kidney function. Diabetic rats treated with green propolis experienced a 36% reduction in proteinuria, with overall kidney function enhancement. Human subjects with type 2 diabetes and early kidney dysfunction witnessed a 22% drop in proteinuria over 3 months upon green propolis supplementation, accompanied by reduced inflammation and oxidative stress markers. Similar to vitamin D, green propolis merits consideration as a frontline therapy for kidney disease management. Ensuring the use of high-quality products containing propolis sourced from uncontaminated Brazilian Baccharis plants is essential. The synergistic action of vitamin D and green propolis is evident in their multifaceted approach to kidney protection, encompassing inflammation mitigation, fibrosis prevention, oxidative damage reduction, apoptosis inhibition, and cell regeneration stimulation. Combining optimized vitamin D levels with green propolis supplementation constitutes a potent yet often overlooked natural protocol for combating kidney disease progression, reducing proteinuria, and preserving kidney function. Take charge of your health today by harnessing the kidney healing potential of vitamin D and green propolis. Remember, your kidneys are indispensable to overall health. Don't wait for a diagnosis when damage may already be extensive. Commence kidney nourishment today with vitamin D and green propolis to shield yourself from proteinuria and progressive kidney decline. I trust you found this video informative and helpful. If so, please like, subscribe, and turn on notifications to stay updated on our latest content. Share this kidney health information with loved ones who may benefit, as your support helps us reach more people with evidence-based natural health advice. Feel free to suggest other video topics in the comments below. I value your input. Take care of your kidneys, and I'll catch you in the next video.